The webinar is part of this 6 webinars that ACCC organized, and the webinars is part of this project where we're initially invited to be part of the geriatric advisory committee. And as part of that, they had wanted to provide some education to the community oncologists and other allied health professionals who are members of the ACCC. So I did one of the webinars that focuses on providing practical tips and recommendations on how to do geriatric assessment and how each team member can contribute to the assessment. Yeah, so the project, it was a survey that inquired about what are the barriers and challenges and what people are currently doing for older adults with cancer. So the results from the survey was very informative in terms of guiding the webinars. So there were a lot of comments about not enough education and time and resources. So the webinar that I did specifically talked about how the nurses, for example, social workers, dietitian, can all contribute to each of the assessment as part of this whole comprehensive geriatric assessment. So it was actually pretty well attended. We had more than 100 people who attended the webinars. Yes, so that webinar specifically, we went through a few assessments. So for example, I talk about the use of geriatric aid and a VES-13, which is the Vulnerable Elder Survey. One is self-reported and the other one is provider administered. And those only take between 2 to 4 minutes. It's easy to do in a clinical practice. It can be done by the physician or the nurses. And in that few minutes, you can generate really useful information that can guide whether the patients then need a full comprehensive geriatric assessment. And that information can be used to either modify treatment or guide supportive care interventions like physical therapy. So simple assessment tool that can potentially change what you do down the line for the patient. Yeah, so it's available on the ACCC website at the moment. So you can visit this website if you don't know where it is. And I think you have to be the member of ACCC to get access to that. But it's all recorded and you can access it pretty easily once you have the website. You have to ask ACCC actually. I think going forward, ACCC is very interested in partnering, continue to partner with us to, they're thinking about more initiative. I don't know exactly what the details yet, but I'm looking forward to continue working with them. They've been a great organization, and one of the mission is to improve care for older adults with cancer. So I'm very excited going forward to continue working with ACCC and Ilana specifically.